Welcome. You are invited to take part in this research project because you have type 2 diabetes with an increased chance of a heart attack or a stroke. It is important that you receive information about this study before you decide to participate. If you do decide to participate, you will be asked to sign a written consent form. The information obtained from your participation in this study may help us understand more about whether the drugs being studied can increase or reduce the risk of cardiovascular and chronic diseases. Taking part in this study may or may not make your health condition better. This study will be done in about 10 countries around the world and will include about 10,000 women and men. The study has been carefully approved by an independent ethics committee and by regulatory authorities in each country. The study doctor or nurse will plan a first screening visit to verify that you are eligible for the study. You will be asked not to eat or drink for 8 hours before the screening visit. During the visit, you will be asked about your health history and medication use, and blood and urine will be collected. When blood samples are taken, you may have some discomfort, brief pain, develop some bruising, feel dizzy, or, very rarely, develop a minor infection where the needle went in. The doctor or nurse will also record basic information such as weight, height, and blood pressure. A pregnancy test may also be done if required. If you are eligible to participate, you will be asked to come for a first treatment visit. We will ask you to do an eye test, and we will perform an ECG to measure the electrical activity of your heart. An ECG is painless. When first applied, the discs may be cold, and in rare circumstances, you may develop a localized rash or irritation where the patches are placed. At this visit, and at every future visit, you will receive counseling on healthy lifestyle. You will be asked to complete questionnaires that measure your quality of life. You will return to the study center after 1 month, 2 months, 6 months, and then every year for a total of 8 hospital visits. At each visit, you will be asked about your health, your medications, and any side effects. At some visits, we will record physical measurements, including blood pressure, weight, and height. Blood will be drawn at the 2-month visit and at the yearly visits to check your glucose and calcium levels. At the 2-year and last visit, you will be asked to complete quality of life questionnaires, and you will also undergo an ECG and simple visual test. Blood and urine samples will also be collected to monitor blood sugar levels, kidney, and liver function. At the first treatment visit, you will be provided with either Lincase or a placebo pill. This will be decided by a computer program, and neither you nor the hospital staff will know if you are taking active drug or placebo. You have the same change of taking placebo compared to Lincase. In case of emergency, the code will be broken. You will have to take the study pills every day for 3 years. Some people who have taken Lincase had the following side effects: fluid retention, which may lead to swelling, weight gain, and rarely difficulty breathing; modest increases in cholesterol; hives or rash, which may be itchy. If important new information develops during the study, which may relate to your willingness to continue participation, it will be provided to you in a timely manner. At all times, your personal and medical information will be kept confidential, and you will be identified only with a code number and initials. If you agree to participate, you are giving permission for your doctors to provide information about your health. Participation in this study is voluntary. You may decide now not to participate, or you may withdraw from the study at any time without affecting your treatment or any benefits. Once the study is completed and you have finished taking all the study medication, you may be contacted and asked to participate in a long-term follow-up study In this study, we would like to monitor any hospital visits you have used for up to 5 years after the study. Thank you for your time and attention.